The foundation of each and every professional encounter begins with the case history. From a coding perspective, it is most integral portion of your encounter. Since the adoption of the resource-based relative value system or RVS for coding compliance, the scorable elements of the case history were chief complaint or the primary reason for visit, history of present illness, review of system, and past family and social history.
Foreign body sensation or yung kapag minsan parang may something na nasa mata nyo, parang narikahol, parang alikabok ba na maliliit wala pero kaya lang, or nakakaranas po kayo ng sudden loss of vision, hindi naman.
So, near-point convergence. Near-point convergence, this is a standard test for convergence ability. It is easy to perform and does not require special equipment. So, this test equipment is a fixation target and a ruler. The fixation target is a pen or pencil. To get the child's attention, a small toy with common character can be used. It should have small details and that are clear to see. Also, there is a special ruler for convergence and accommodation testing. If the patient is highly myopic or hyperopic, the test should be performed with the needed correction. Corneal light reflex test, also known as the Hurd-Burge test, is a simple exam that checks for eye alignment by observing how light is reflected from the cornea of the eyes. So during the test, a patient centers their focus on a special light and an eye doctor observes where the light is reflected. The corneal light reflex is normally centered on both pupils, but if it's not centered, an eye alignment disorder may be present. For accurate results, it is important that the patient's head is positioned straight and upright during the test or not tilted, and that both eyes are focused directly on the light. While this process is helpful for identifying ocular alignment problems in children, it can also be used to detect underlying conditions in adults of their eyes appear to be misaligned. Smooth pursuit test. The smooth pursuit test measures the patient's ability to accurately track a visual target in a smooth, controlled manner. Smooth pursuit tracking assesses the patient's central vestibular system, although several methods of smooth pursuit tracking have been researched. It is the controlled velocity method that has been proven to be the most clinically useful. Therefore, it is the controlled velocity method that is shown in this guide. The cover-uncover test is useful to identify atropia and differentiate it from aphoria. The test is done by using an opaque or translucent occluder to cover one eye. The occluder is held in front of the eye for a few seconds and then removed. When the fixing eye is occluded, the eye examiner will observe the non-occluded eye move to pick up fixation if atropia is present. If no tropia is present, the non-occluded eye will remain stationary. To assess for aphoria or latent deviation, the examiner observes the eye behind the occluder. If aphoria is present, the uncovered eyes does not move. However, the eye that is behind the occluder will deviate and return to a straight position when the occluder is removed.